Sharira, Amrita School of Ayurveda, Kollam, Kerala. Sir is having a total experience of 7.5 years, and Sir has published four main articles in two international and two national journals. Sir is right now working in Amrita School of Ayurveda as HOD of Rachana Sharira. I welcome you, sir, on behalf of Department of Rachana Sharira and also Shiva Ayurvedic Medical College and Hospital, Bilaspur. Welcome, sir.
Thank you. Thank you. Thank you, Dr. Anu. Thank you. Thanks a lot.
Okay, sir. So you can continue your session. Thank you, sir.
Okay. I'm audible, right?
Yes, sir, you are.
Okay. Thank you. Okay. Very good morning, everyone. My name is Dr. Sharath, and today I'm going to talk regarding the urinary system or urinary organs anatomy. So I hope the screen is visible to everyone. Please let me know whether full screen is visible or not. The full screen is visible?
Yes, sir. Yes, sir. It is visible.
Okay. Okay. Great. Yeah. Great. Yeah. Thank you. This class will be like purely with the gross anatomy of the urinary system organs. I'm not going in detail about the microscopic anatomy and all. As per the UG undergraduate level, I feel the gross anatomy is more important. Yeah. So let's begin with the topic. So the urinary organs include mainly the organs which are involved in the formation as well as the elimination of urine. So as the name says, urinary system or urinary organs, we'll concentrate only about those aspect of the organs which are involved in the formation and excretion of the urine. Of course, the kidneys are having enormous other physiological functions. Let's not deal about the much about the physiology here. Okay, so we'll discuss more only about the anatomical aspect of the organs here. So the urinary system organ includes kidneys. There are a pair of kidneys, right and left, and a pair of ureter, right and left. Okay, and the urinary bladder as well as the urethra. Okay, so we'll begin with the kidneys. Keyboard is not working. I don't know. Okay, the kidneys are a pair of excretory organs. Okay, usually the kidneys are having kind of adjectives we always use like renal or renes. Okay, or the nephro. Nephro is because of the main functional and structural and functional unit nephrons. Okay, then the kidney is involved in different functions, as I mentioned earlier, like removal of the waste of the metabolism and removal of the excess of water and salts, and it maintains the blood pH as well as the regulation of the blood pressure with the most important mechanism, that is the renin-angiotensin mechanism. And of course, the renal calculi is the most commonly encountered condition, clinical condition. So then, coming to its location, the kidneys are located on in the posterior aspect of the abdomen, or the posterior cavity of the abdomen, on either side of the vertebral column. They lie on both sides of the vertebral column, and of course, they are retroperitoneal organs. They lie behind the peritoneum. Only the anterior surface is partially covered by the peritoneum here. So they are known as the retroperitoneal organs. And the kidneys are having two poles, upper poles and lower poles. The upper poles are located at the level of upper border of the 12th thoracic vertebra, or sometimes the lower border of the 11th thoracic vertebra. And the lower poles are approximately at the level of 3rd lumbar vertebra. And among the 9 regions of the anterior abdominal wall, the kidneys will occupy these 4 regions: the epigastrium, the both hypochondriac regions, and the both lumbar regions, that is the right and left lumbar, as well as the umbilical region. So you can see in the picture here the 9 quadrants of the abdomen, and the kidneys are shown in the picture here. You can see they are present in the epigastric, umbilical, hypochondriacs, as well as in the lumbar regions. And the upper pole and lower pole, you can see the upper pole is present exactly at the upper border or the lower border of the 11th thoracic vertebra, or the upper border of the 12th thoracic vertebra, and the lower border is at the level of 3rd lumbar vertebra. Coming to the shape and size, as I mentioned earlier, the kidneys are either bean shaped or reniform shaped. Okay, the reniform is once again the bean shape itself. Okay, and the weight of the kidney is approximately in females it is around 135 grams, and in males it is around 150 grams. And the length or the measurements, the length is around 11 to 12 centimeters, the width is around 6 centimeters, and it is having thickness of 3 centimeters. And the color of the normal kidney is around reddish brown. So this is the kidney and its measurements. The length is calculated in this way. Okay, 12 centimeters, and the width is 6 centimeters, and the thickness is 3 centimeters. And on the medial aspect of both the kidneys, we have the most important part, that is the hilum of the kidney, where the structures will go in and come out. Coming to the orientation. So even though the kidney is measured in a different way, the placement of the kidney inside the human body is having particular information. That is the long axis and the transverse axis. The long axis of the kidney is like they are directed downwards and laterally. Okay, so you can see in the picture here they are directed downwards and laterally. Okay, downwards and laterally, both the kidneys. Okay. And the upper poles are lying approximately near to the median plane. Both the upper poles are lying close to the median plane, and the transverse axis is actually laterally backwards. Transverse axis of the kidney are placed laterally backwards. So this particular information is very important. Both the kidneys are understood in terms of the transpyloric plane in the surface anatomy. The hilum of the right kidney is lying, or the transpyloric plane crosses the hilum of the right kidney in its upper part, whereas the transpyloric plane crosses the lower part of the hilum in the left kidney. So you can see this particular line is crossing near the upper aspect of the hilum of the right kidney, whereas in the left kidney it is going near the lower aspect. Coming to the external features or the parts of the kidney. So basically kidney has 2 poles, 2 borders, and 2 surfaces. 2 poles are being upper and lower poles. The 2 borders being the medial and the lateral borders, and the 2 surfaces are being anterior and posterior surfaces. So we'll see each one of these features now. The 2 poles, the upper pole is actually broad and having a relation, or it gives place for the, or it gives seat for the corresponding suprarenal gland. SRG refers to suprarenal gland, meaning the right kidney upper pole is allowing the right suprarenal gland to be placed there, and the left kidney upper pole is allowing the left suprarenal gland to be related there. Okay, and the lower pole is pointed. Lower pole is pointed. You can see the lower pole is somewhat pointed. Okay, so this is one among the criteria for identifying the side of the kidney. Okay, so if a given specimen is there, then to identify which side it belongs to, or to determine the side, you need to know the features of the upper pole and lower pole also. Coming to the surfaces, there are 2 surfaces, anterior and posterior surfaces. The anterior surface is irregular. It is wavy, or you can say it is kind of rough margins will be there. Okay, and posterior surface is flat and smooth. posterior surface is usually resting on the posterior abdominal wall. So it is, there are no any impressions, or there's only musculature. So it will have a smooth and flat surface. Okay, so this is one among the, this is also one of the criteria to determine the side of the kidney. Then coming to the borders are lateral and medial border. The lateral border is convex. You can see the lateral border is convex, and the medial border is concave, and the middle border has a depressed middle part, that is the hilum or the hilus. Hilus is plural, hilum is singular. So coming to the hilum of the kidney, the hilum of the kidney has three important structures seen in an order. Okay, from anterior to posterior we can see the structures through the hilum. Okay, so the anteriorly, first one is the renal vein, then next second one is the renal artery, and the third one is the renal pelvis. So this is the ultimate factor which determines the side of the kidney. Okay, sometimes even the anterior and posterior surface can get confused, okay, because of any kind of underlying illness or something, but this particular information will never change. Okay, so anteriorly, the first one is the renal vein, second one is the renal artery, and third one is the renal pelvis, from anterior to posterior. Coming to the relations, so both the kidneys will share some common relations, especially in terms of peritoneum. Okay, the peritoneum is covering only the anterior surface of both kidneys. There is no posterior relation for the peritoneum in the kidneys. And some other common relations here to be remembered. For the upper pole, for the both kidneys, it is related with the suprarenal glands. That is the corresponding suprarenal glands. The right kidney upper pole is with the right suprarenal gland, and the left kidney upper pole is with the left suprarenal gland. The lower pole is of both the kidneys are lying approximately around 2.5 to 3 centimeters above the iliac crest. Okay, above the iliac crest. Coming to the medial border, the medial border will have of both, medial border of both kidneys will have common relations. That is the corresponding suprarenal gland above the hilus, and the beginning part of the ureter below the hilus. Beginning part of the ureter. So this is a picture representing the peritoneal relations for both the kidneys. You can see this blue color represents the peritoneal covering here. Okay, so where only the anterior surface is covered by peritoneum. Posteriorly, there is no peritoneum. In this picture, we can see both the hilum. Okay, this is the right kidney hilum. This is the left kidney hilum here. Okay, so upper part of the medial border near the hilum. Okay, we have the suprarenal gland, and the lower part of the the medial border is related with the corresponding ureter. Okay, medial border is related with the ureter. This is also the ureter here. Other common relations are found in the posterior surface. Both the kidneys of the posterior surface, the posterior surface of both kidneys are having these relations in common. The diaphragm, along with the medial and lateral arcuate ligaments, then the psoas major muscle, quadratus lumborum muscle, then the transversus abdominis muscle, and the on the right side, right and left side, there is a small difference, but in general, they are the ribs itself. The right kidney posteriorly relates with only the 12th rib, whereas the left kidney is relating with both 11th and 12th ribs. You can see in the picture here, you can see the green color represents here the diaphragm, the relation with the diaphragm. You can see the both kidneys on its posterior surface, they are related with the diaphragm. Okay, so when you see from posterior side, the right kidney is on the left hand side. You can see on the left kidney is on the other side. Okay, and the other colored area, more extreme laterally, we have the transversus abdominis muscle related on both kidneys. See here, and this one also on the left side. And the middle large area is for the quadratus lumborum muscle, and near the hilum and the medial border, we have the psoas major muscle being related. And you can see for the left kidney, we have both the 11th rib and the 12th rib related posteriorly. But for the right kidney, we have only the 12th rib, because the right kidney is lying slightly lower than the left kidney because of the presence of liver on the top of it. Coming to the other visceral relations which are different for both kidneys. Okay, so the right kidney is related, having relation in the anterior surface with the suprarenal gland once again, the liver, which is separated by peritoneum here, and the second part of the duodenum, that is the descending part of the duodenum, and the hepatic flexure of the colon, as well as the loops of the small intestine, once again separated with the peritoneum here. Whereas the anterior surface of the left kidney is related with the left suprarenal gland, the spleen separated by peritoneum, stomach once again separated by peritoneum, the pancreas, usually the tail part of the pancreas, the splenic vessels and the splenic flexure of the colon, and part of the beginning of the transverse colon, then the jejunum, which is once again separated by the peritoneum here. The lateral border of the right kidney relates with the right lobe of the liver and the hepatic flexure once again, whereas the lateral border of the left kidney is relating with the spleen as well as the descending colon. So these are the different relations for both the kidneys, anteriorly as well as lateral border. So the kidneys have common relations in the posterior surface as well as in the medial border. Okay, whereas the kidneys have different relations in respect to the anterior surface and the lateral border. So you can see in this picture here. Okay, so anterior surface of both kidneys. Okay, on the top of the anterior surface we have the suprarenal gland, and there's a large area including the lateral border of the right kidney. We have the hepatic area where the liver is related, that is the right lobe of the liver. Okay, then we have the duodenal area near the hilum and the medial border, that is the second part of the duodenum here. Okay, and there's a colic area where the hepatic flexure of the colon is being related here. And coming to the left side, left kidney, so you can see there's a large area for the splenic area or the spleen, where the anterior surface as well as the lateral border are related. And in a small portion of the lateral border and the anterior surface is related with the colic area, where you can see the splenic flexure as well as the beginning of the descending colon. And there is a jejunal area, okay, here, and there is a pancreatic area near the hilum where the tail of the pancreas is being related here. And of course, you can see a triangular area here just below the suprarenal gland where the stomach is being related. So if you remember the chapter of stomach where the stomach bed is being discussed as the posterior relation of the stomach, posterior surface of the the body of the stomach. So there you can see the left suprarenal gland as well as the left kidney are related, are mentioned under the stomach bed structures. So the gastric area here refers to the stomach. Okay, this is another picture where you can see the pancreas is being related here. Okay, and even the suprarenal glands are seen, and the duodenum is seen here. The second part of the duodenum, you can see the vertical part or the descending part. Okay, and also the peritoneal covering also you can see here. So in this picture, you can see once again the hepatic flexure as well as the splenic flexure and the beginning of the the descending colon. This picture is clearly shows you about the how liver is related with the kidneys, and because of this kind of relation, the liver will have a renal impression in its inferior surface. If you see the impressions of the liver, impressions on the inferior surface of the liver, you will find a renal impression also. That is because of the lateral border of the right kidney. So that was about the relations. Now we'll move on to the coverings of the kidney. So the kidney is actually covered by capsules. Okay, so generally we name it as renal capsule, but it has got different layers. Okay, the first layer from inside to outside here, the first layer is the fibrous capsule or just the renal capsule. It's also known as the true capsule of the kidney. Okay, then outside to that we have the perirenal or the perinephric fat. Okay, so just on the surface of the kidney you will find the renal capsule or the fibrous capsule. Okay, and just outside to that we have the perirenal or the perinephric fat. Perirenal or the perinephric fat. Then outside to this particular perinephric fat, we have the renal fascia. Renal fascia. Renal fascia is also known as the fascia of Garota or Garota's fascia. Okay. This particular fascia is derived from the condensation of the peritoneum itself, extraperitoneal tissue. Okay. So it will have two layers, anterior layer and the posterior layer. The anterior layer is named as the fascia of Tall, and the posterior layer is known as the fascia of Zuckerland. And outside to this particular renal fascia, we have pararenal or the paranephric fat. Pararenal or the paranephric fat. So in this picture, you can see here the kidney. Okay, this is the kidney, and here is the renal sinus. Okay, so this is actually a transverse section of the left kidney, you can say. And here you can see the first layer, which is marked here in the black color, is the renal capsule. Is the renal capsule or the true capsule. Okay. Next to that, we have the perirenal fat. Okay, perirenal fat. Then we have the fascia of Garota in its anterior aspect, the fascia of Tall, and the posterior aspect we have the fascia of Zuckerland. Fascia of Zuckerland. And outside to that, we have a small area here. This is the fat accumulated here, which is nothing but the paranephric or the pararenal fat. Paranephric or the pararenal fat. So if a person is very lean, then the amount of pararenal fat or the perinephric fat will be very less. Okay, will be very less. But if the person is a little obese or a little hefty, then definitely when you are dissecting, you can really see the accumulation of fat around the kidneys. And okay, so this is the same picture once again. Okay, coming to the individual layers. First one is the renal capsule. It's a true fibrous capsule. It envelops the whole kidney. Okay, and it can be removed easily. Okay, this layer is easily separable. Okay, in a healthy kidney, I'm talking about in a living and healthy kidney, not in a specimen. Okay, but this layer is having a chance of getting adhered to the surface of the kidney in case of any kind of inflammatory pathologies. Okay. Like kind of nephritis. Okay, so then the kidney parenchyma is inflamed, then this fibrous layer is going to stuck there itself. So its main function is giving support and protection to the kidneys. Coming to the perirenal fat, meaning next to the renal capsule. It is basically the adipose tissue, the fat itself. Okay, it is thickest along the borders. Okay, thickest along the lateral as well as the medial borders. Okay, it also envelops the blood vessels of the kidney. Okay, where the blood vessels are entering through the hilum. Okay, it envelops that particular structures also. Next one is the renal fascia or the false capsule. It is called as false capsule. It's a fibromembranous layer. Okay. It covers the kidney as well as the suprarenal gland, whereas the true capsule covers only the kidneys, not the suprarenal gland. Whereas the renal fascia or the false capsule will cover both the kidneys as well as the suprarenal gland. It is nothing but the condensation of the extraperitoneal tissue. So it is having two parts. Anterior layer is known as the fascia of Tall, and the posterior layer is known as the fascia of Zuckerland. So both all these renal fascia and the capsule are having great importance in surgical aspect. Coming to the last layer, that is the paranephric fat. So it is outside the renal fascia. It is seen more on the posterior aspect. It gives a soft cushioning effect for the kidneys. So the clinical importance of these coverings is one is nephroptosis, other one is the perinephric abscess. Okay. The nephroptosis means usually in person where the paranephric fat is less or is absent, there's a chance of displacement of the kidney from its location. Okay, so in this picture you can see here it's a posterior view. Okay, the right kidney is lower here. Okay, but this is a normal one, and in this picture you can see L1 vertebra is here, whereas the right kidney has displaced much below. Okay, near L2, L3, L4. It is present near the L4. You can see here. The hilum is present near the L4. This is called as nephroptosis. Ptosis means drooping or downward displacement. Okay, so nephro is kidney. So nephroptosis. So this is another condition, perinephric abscess. You can see this left kidney is the right kidney here. You can see. So around the right kidney, there is a large collection of the fluids. That is the perinephric abscess. Coming to the structure of the kidney. So it is very briefly, I have explained the structure of the kidneys here. So each kidney will have an inner medulla and a sinus and an outer cortex. The medulla will have around 8 to 18 or sometimes 20, renal pyramids. Okay, to the maximum 20 pyramids are also been seen there. Okay, the sinus will have the branches of the renal artery, tributaries of the renal vein, and the renal pelvis. Of course, renal pelvis is the beginning of the ureter. The cortex will have arches, lobules, and renal columns. First one is the renal medulla. Okay, so the renal medulla is having around 8 to 18 renal pyramids. Okay, so this particular triangular structure is known as the renal pyramid here. Okay, this is known as the renal pyramid. Okay, so in this picture we can see 1, 2, 3, 4, 5, 6, 7. There are 7 pyramids here. Okay, so this is one pyramid being seen in this picture here. Okay, so the pyramid consists of the nephrons. Okay, the structural and the functional basic units of the kidney. The base of the pyramid is directed towards the cortex. So you can see this is the cortex here. So the base of the pyramid is directed towards the cortex, and the apex is opening in the renal papilla. Okay, apex is opening in the renal papilla towards the renal sinus. Okay, towards the renal sinus. I'll come to that renal sinus later. Okay. Each renal papilla of the pyramid will be having around 16 to 20 collecting ducts, which are part of the continuing parts of the nephrons itself. The collecting ducts or the duct of Bellini, which open into the minor calyx. So minor calyx, different minor calyx will join to form the major calyx. The major calyx will further join to form the renal pelvis. This is the place where the urine is being secreted out. Okay, you can see here, these are the renal columns. The gap in between the two pyramids is nothing but the renal columns. Okay, and this part is the cortex where the lobules will be present. Okay, and you can see the minor calyx are opening to the they are towards the apex of the pyramids. Okay, then each minor calyx will join to form the major calyx, and the major calyx of different location will join to form the renal pelvis, and the renal pelvis will further continue as the ureters. Coming to the renal sinus, so you can see in this picture, the blue colored area which is marked here is nothing but the renal sinus. And the renal sinus is actually a cavity kind of space. Okay, it's occupied by the renal pelvis, renal calyces. The calyces includes both major and minor calyces, the blood vessels and lymphatics, as well as the nerves and the adipose tissue also. You can see here, the renal sinus once again. You can see the blood vessels as well as the lymphatics. Coming to the renal cortex. The renal cortex is kidney tissue. It's the renal parenchyma between the base of the pyramid and the surface of the kidney. So as I mentioned earlier, the pyramid is having an apex and a base here. Okay, so the base of the pyramid and the surface of the kidney. So whatever is present, that is nothing but the renal cortex. The cortex will have cortical lobules as well as renal columns. Coming to the microstructure. Okay, so this is also in brief only. So the microstructure is actually divided into 3 aspects here. One is the secretory part, other one is the collecting part, and other one is the juxtaglomerular part apparatus. Okay, so the secretory part will have the renal corpuscles, which are meant for the filtration, and the renal tubules, which are meant for the selective reabsorption. And the collecting part are mainly ending in the ducts of Bellini, which will open into the apex of the pyramid through the renal papilla. The juxtaglomerular apparatus will help in the regulation of the blood pressure. That is through the renin-angiotensin mechanism. The cells in the juxtaglomerular apparatus will help in the secretion of the prorenin. Help in converting the prorenin to the renin. Okay, this is I think already you might be knowing about this, the structure of the nephron. This is also not in detail. This is not the detailed structure. This is just a representation picture. Okay. Coming to the blood supply. Okay, the blood supply. Coming to the arterial supply, both the kidneys are supplied by the renal arteries, which are the direct branches of the abdominal aorta. Both the right and left renal arteries are the direct branches of the abdominal aorta. They also, there is, one other artery, that is the accessory renal artery. Accessory renal artery. Okay, so this is how the renal artery is going to be, forming, or the leading to the blood supply inside the kidney. Okay. Okay. So you can see the renal arteries. Renal artery will first, give out branches, that is the anterior and posterior branches. Okay. And they further continue as the segmental arteries. The segmental arteries will further, divide into interlobar arteries. Okay, you can see the renal arteries coming inside, the red color here, and they're dividing into, segmental arteries here. Okay, the segmental arteries will further divide into interlobar arteries, and these interlobar arteries, when they reach on the top or the near the base of the pyramid, they continue as the arcuate artery. And these arcuate arteries will give rise to small radiating branches, which are known as cortical radiate artery. You can see these are these small red, red strings. What you see here, they are the cortical radiate branches of the arcuate artery. Okay, so these end up in afferent arterioles. These radiating branches will further ramify, and they end in the afferent arterioles, which are very microscopic. So these afferent arterioles will enter through the glomerulus of the nephron, and they come out as the efferent arterioles. These efferent arterioles will again form the peritubular capillary plexus. Different nephrons together will leave the efferent arterioles, and they mix up and they form the peritubular capillary plexus. And from these peritubular capillary plexus, the venules will emerge, and these venules will again join to form the cortical radiate vein. You can see the small blue color lines here along with the cortical radiating arteries. Okay, so they are the cortical radiate vein. So these cortical radiate vein further join to form the arcuate vein. These arcuate veins joins to form the interlobar veins, and multiple interlobar veins from different pyramids will join to form the renal vein. So the renal vein will again drain directly to the inferior vena cava. So this is how the renal circulation happens. Once again, in this picture, you can see how the cortical radiate vein and cortical radiate artery are being formed from the arcuate artery and the arcuate veins. Okay, based on this particular blood supply of the kidney, the whole kidney is divided into vascular segments or vascular lobules, you can say. Okay, there are 5 vascular segments. Okay, 4 on the anterior surface and 1 on the posterior surface. So anteriorly, we can see the apical, superior, middle, and inferior lobules. Okay, or segments, you can say. And posteriorly, we can see the posterior as well as the apical and the inferior. And along the lateral margin, we can see the superior and the middle lobules. So this is a lateral view where you can see all the 5 lobules: the apical, superior, middle, inferior, and posterior lobules. So the ramification of the blood supply is specific to these lobules. Okay, each lobule will have their own set of arterial network as well as the venous network. Okay, this I already mentioned. The venous drainage is beginning from the peritubular capillary plexus and ends up in forming the renal vein, and which drain to the inferior vena cava. Coming to the lymphatic drainage of the kidneys, they are mainly drained by the lateral or the para-aortic group of lymph nodes, which are located near the origin of the renal arteries. Coming to the nerve supply of the kidney, it's basically from the renal plexus, which is derived from the celiac plexus, where the sympathetics will be from the T10 to L1 segments, and the parasympathetic is by the vagus nerve, and the pain stimulation or the pain sensation is mainly from the T10 to T12 segments, which cover the or which also involve the skin around the posterior aspect of the body, where the renal pain is actually being felt. Now you can see renal angle. This is one of the clinical important or you can say surface anatomical importance. The angle between the lower border of the 12th rib around the and the outer border of the erector spinae muscle. So in this picture, you can see this is the erector spinae muscle, a muscle of the posterior aspect of the body, or the back muscle of the back. Okay, this is the erector spinae muscle and the 12th rib and the 12th rib. Okay, so the angle between these two, okay, angle between these two is known as the renal angle. So usually the tenderness will be elicited in this particular location, in this particular area, in this angulated area. The tenderness, any pain or any lesion of the kidney, the pain or the tenderness will be seen in this particular location. You can see here once again, the renal angle between the lower border of the 12th rib and the lateral border of the erector spinae muscle. So usually the renal colic, okay, the renal pain is having a specific pattern. It starts from this particular renal angle or the loin, okay, and then moves to the groin and moves to the groin. So the specific pattern of the renal colic is loin to groin. The loin is the area where the renal, from the renal angle till the iliac crest. Okay, renal angle to the iliac crest, we have the loin region. Okay, so from loin to groin. So from the pain starts from the back and enters to the anterior aspect till the groin region. There is the specific pattern of the pain in any kind of renal colics. So coming to the surface markings. Okay, the kidney on the posterior aspect is located with the help of a parallelogram. It is the Morris parallelogram. It's called as Morris parallelogram. So exactly, the kidney can be located in a in a rectangle shaped surface marking. There are two horizontal lines and two vertical lines will form this particular parallelogram. The two horizontal lines being the first line at the level of T11 spine, okay, and the second line at the level of L3 spine, okay. First line crossing the T11 spine and second line crossing the L3 vertebra, okay, L3 spine. The two vertical lines are being the first line around 2.5 centimeters away from the midline, okay, crossing these two horizontal lines, and other line is 9 to 9.5 centimeter away from the median plane, once again crossing two horizontal lines. So it will form this kind of parallelogram. The kidney is supposed to locate in this particular parallelogram itself. The hilum will be around at the level of lower border of the L1 vertebra. Hilum will be at the level of lower border of the L1 vertebra. So this is how we locate the kidney in the posterior aspect. Same thing. Okay. Coming to the front, okay, how we can locate the kidney on the anterior abdominal wall. Okay, so we can locate the center of hilum and the upper pole and the lower pole of both right and left kidneys. First, we'll see the center of hilum, how it can be located in the right kidney. So the right kidney hilum is located 5 centimeters from the median plane below the transpyloric plane. So in this picture, you can see this is the transpyloric plane. Transpyloric plane is here. So the midline is here. This is the midline, 5 centimeter towards the right side. Okay, little below. okay, little below the transpyloric plane. So just go along the transpyloric plane towards right side, approximately around 5 centimeter, and little below will have the hilum of the right kidney. So to identify transpyloric plane, very simple. So just keep one hand breadth below the xiphoid process. That is the transpyloric plane, or the midpoint of the line joining between the xiphoid joint and the umbilicus. And the upper pole of the right kidney is located around 4 to 5 centimeters from the midline, in between the xiphoid process and the transpyloric plane, little downwards once again. So you can see xiphoid process and the transpyloric plane just locate the midpoint, and around 4 to 5 centimeters little below will be the upper pole of the right kidney. Then lower pole of the right kidney is around 6 to 7 centimeters from the midline at the level of umbilicus. So you can see the lower pole is here. Okay, the lower pole at the level of umbilicus around 6 to 7 centimeters, 6 to 7 centimeters from the midline. So for the left side, for the left kidney, we have 5 centimeter. The center of hilum is located 5 centimeter exactly on the median plane, above the level of transpyloric plane. So above the level of transpyloric plane, you can see the transpyloric plane is passing here. So above the level, we'll have the hilum of the left kidney. Then the upper pole is exactly located at around 4 to 5 centimeter from the midline, in between the xiphoid process and the transpyloric plane. So xiphoid process and the transpyloric plane, so 4 to 5 centimeter towards the left side. The lower pole is located around 6 to 7 centimeter from the midline at the level of subcostal plane. The lower pole, you can see it's located at the level of subcostal. This is subcostal plane is here. This is subcostal plane, or just above the level of umbilicus, 6 to 7 centimeters towards the left side along the subcostal plane. So this was about the gross anatomical consideration. So now we'll see some clinical anatomical informations of the kidney. So coming to the gross anomalies of the kidney, renal atresia. So renal atresia means either complete absence of the kidney, or complete absence of both kidneys, or partially like one kidney only, maybe not developed or not being formed. Okay, that is called renal atresia. Then hypoplasia or hyperplasia, meaning reduced in size or increase in size. That is a hypoplasia or hyperplasia. Or sometimes duplex kidney. In any one side, there will be two kidneys extra. Okay, so usually we have two kidneys meant in one body, whereas in duplex kidney, any one side will have two kidneys. So duplex kidney is also possible with duplex ureters also. Anomalies related to the shape, there are two anomalies. One is the horseshoe kidney, where both the kidneys, the right and left kidneys, are fused together, especially in the lower poles. They are fused in the lower poles. Upper poles are free. Whereas the pancake kidney, it is like fused. Both the kidneys are fused together, both the completely fused and lying in the midline. So this is an MRI showing the horseshoe kidney here. As you can see, this is the horseshoe kidney. Coming to the anomalies related with the position of the kidney. So kidneys are usually displaced, and they are being present in the sacral region or in the lower lumbar region. Sacral region or in the lower lumbar region. So in this picture, you can see this in both the cases. You can see the kidneys are being present in the sacral region here. Okay, sacral region. So other one, most commonly seen congenital anomaly, that is the congenital polycystic kidney. So where the kidney parenchyma is completely formed into cysts, polycystic kidney. Okay, that is the. And most commonly seen clinical condition among the practice, that is the renal calculi. So you will find different kind of renal calculi based on their chemical constituent: oxalate calculi, uric acid crystals, triple phosphate calculus, and cysteine and xanthine calculus. And staghorn calculus is considered to be the biggest, or the largest calculus being formed in the urinary system. It occupies completely the renal pelvis or the renal sinus and part of the ureters also. That is the staghorn calculus. So in this X-ray, you can see both the kidneys are having staghorn calculus. Thank you. So this was about the anatomical aspect of the kidneys. So next we'll move on to the ureters. So today we'll finish with the ureters. So tomorrow's session we'll finish with the bladder as well as the urethra. You need any gap in between?
Sir, it is fine, sir. No issues. You can continue.
Okay, yeah, fine. Yeah, the screen is visible.
Yes, sir.
Yes, sir. Yes, sir. Yes, sir.
Yeah, okay. So we'll move on to the ureters now. The ureters are pair of thick-walled muscular tubes, okay, and they are very narrow. The diameter is around 3 millimeters alone, okay, and their main duty is to transmit or convey the urine from kidney to bladder, and it will have a peristaltic contractions also. So because of which the small kind of stones or calculus will be easily passed through this particular ureters. Their location, once again, they are located deep to the peritoneum. They are retroperitoneal, and the upper part of the ureters are located in the posterior abdominal wall, and the lower part is in the lateral pelvic wall. Okay, lateral pelvic wall. So the ureters will share location in the abdominal cavity as well as in the pelvic cavity. So you can see in this picture. Okay, so these are the ureters here. Okay, so up to this particular the bifurcation of the common iliac arteries, okay, it is the abdominal part, and below that we have the pelvic part. Coming to its dimensions, the length of the ureters are 25 to 30 centimeters, approximately around 10 inches, and the abdominal part is 5 inches in length, and the pelvic part is 5 inches in length. The diameter is around 3 millimeter, and you can find 3 constrictions in the ureters. You can find 3 constricted areas in the ureter, and those are the areas commonly where the calculus or the stones are being obstructed. Coming to its course, the ureter begins within the renal sinus as renal pelvis. Okay, so previously we saw the renal sinus. So in the renal sinus, the renal pelvis will begin, and it moves downwards and slightly towards the medially, and it is passing on the psoas major muscle, and then enters pelvis by crossing in front of the common iliac artery, and reaches the base of the bladder, and enters the bladder wall obliquely and open into the lateral angle of the trigone. So the trigone is present in the internal aspect of the urinary bladder. We'll discuss it tomorrow. Okay. So basically, like 4 different structures to be remembered in the course. That is the renal sinus, where the renal pelvis is going to begin, and it moves on the psoas major muscle and crosses the common iliac artery and reaches the base of the bladder. Coming to the constrictions of the ureter, okay, at the pelvi-ureteric junction. So the first constriction is seen at the pelvi-ureteric junction, where the renal pelvis is terminating and the ureter itself is beginning. Okay, that is the pelvic-ureteric junction. That is the initial construction. You can see the pelvis diameter is more and immediately it is going to be less. So that is the pelvic-ureteric construction. Then at the brim of the lesser pelvis, at the brim of the lesser pelvis. So lesser pelvis where the bony lesser pelvis margin is seen. So there actually another construction is being present. And finally, at the passage through the bladder wall, at the passage through the bladder wall. So when it is entering into the urinary bladder, so there also you will find another construction. Okay, so this is okay, this is an X-ray where a stone is being a calculus is being obstructed somewhere above the or just below the pelvic-ureteric junction possibly. Okay, then we have the okay, so this is coming to the renal pelvis. It is a funnel-shaped dilatation at the upper part. So you can see this funnel-shaped. Okay, there's a representation picture here. Okay, and it is formed by the union of major calyces. So the major calyces are formed by the union of minor calyces. Okay, so these are the major calyces. Okay, in this picture you can see three major calyces. So all these three will unite to form the renal pelvis. The renal pelvis will pass downwards and medially through the hilum. It will pass downwards as well as medially through the hilum. So meaning the midline is towards the midline. Coming to the abdominal part of the ureter, its course is like it passes downwards and medially by passing beneath the peritoneum or behind the peritoneum. Enters pelvic cavity by crossing the termination of common iliac artery. Okay, so the common iliac arteries are the terminal branches of the abdominal aorta. So the common iliac arteries, after running for a short course, they again terminate by dividing into external and internal iliac arteries. So at that particular termination of the common iliac artery, we have the the ureter will cross and move downwards. That is to form the pelvic part. Okay, that is the pelvic part. Coming to the posterior relations of the abdominal part. So we have the psoas major and the fascia covering the muscle. Okay, and the genitofemoral nerve. Okay, the genitofemoral nerve is one of the important nerve from the lumbosacral trunk or the lumbar plexus, we can say. Okay, the tips of transverse process, tips of the transverse process of lumbar vertebra. And coming to the anterior relations of the abdominal part, on the right hand side we have the parietal peritoneum, right gonadal vessels. So the gonadal is a common term given for both male and female reproductive organs here. Okay, so the right gonadal vessels, in males it will be right testicular vessels, and in females it is the right ovarian vessels. Okay, ovarian artery as well as vein, testicular artery as well as veins. And third part of the duodenum, it is also related to the third part of the duodenum, and right colic and ileocolic vessels, and the root of the mesentery, and the terminal part of the ileum, Coming to the anterior relations of the left hand or the left ureter, abdominal part. Once again, parietal peritoneum, left gonadal vessels, left colic vessels. Instead of duodenum, we have sigmoid colon here, and the apex of the sigmoid mesocolon. And the medial relations, very important here. Right side, we have the inferior vena cava. Okay, for the right ureter, medially we have the inferior vena cava. You can see picture here. This is the right ureter here. Okay, you can see the inferior vena cava is passing on the medial side of the right ureter. For the left ureter, we have the inferior mesenteric vein as well as artery. So you can see inferior mesenteric artery here and inferior mesenteric vein. So inferior mesenteric vein here is draining to the splenic vein and joins with superior mesenteric vein to form the portal vein. And the gonadal vessels. Okay, gonadal vessels. Okay, left gonadal vessels. Okay, left testicular artery as well as left ovarian artery, and left testicular vein as well as the ovarian. So we can see here. So this is the left gonadal vein, which is draining to the left renal vein. Okay, left gonadal vein drains to the left renal vein, whereas the right one drains to the directly to the inferior vena cava, whereas the left one will drain to the renal vein. Whereas the arteries are right and left gonadal arteries are the direct branches of the abdominal aorta itself. Coming to the pelvic part, okay. So the pelvic part is actually divided into 3 parts. Okay, we have 3 parts again for the pelvic part of the ureter. The first part, which is moving downwards, so having posterior relation as internal iliac artery, internal iliac vein, lumbosacral trunk, sacroiliac joint. Coming to the lateral relation, it is the obturator artery, vein, as well as obturator nerve, and the middle rectal artery, So these are the relations of the pelvic part of the ureter, first part. Second are oblique part. Okay, second are oblique part. In males and females, we have different relations for these this particular second part. In males, we have the ductus deferens superiorly and seminal vesicles inferiorly. So you can see this is the male, pelvis. Okay, so it's a representation picture once again. You can see the pelvic ureter here. Okay, this is the pelvic ureter here. Okay, so just in superiorly we have the ductus deferens. The green color is the ductus deferens here. Okay, inferiorly we have the seminal vesicles. In females, we have this particular pelvic part of ureter is the second part is or the oblique part is actually present in the broad ligament of the uterus. So that is why in any kind of surgical procedure, it needs to be like very taken care of very carefully, not to damage the ureters. So and it is having relation with the uterine artery in the front, and it lies 2 centimeters lateral to the supravaginal part of the cervix. So you can see here the uterine artery. Uterine artery is present in the front. Okay, this is the uterine artery here. It's very close. Okay, uterine artery is very close here, and the supravaginal part of the uterus is actually present 2 centimeters lateral to it. Coming to the third part or the intravesical part. Okay, so intravesical means it is present in the wall of the bladder. So wall of the urinary bladder. The vesicle means here the bladder. Okay, that is why it's called as intravesical part. So it pierces the musculature of the bladder, undergoes oblique course downwards and medially through the bladder and opens into the interior of the bladder. Okay, and it will have a valvular action. And it is present, meaning both the ureters open into the bladder around 5 centimeters apart in a distended bladder. Okay, when the bladder is distended, okay, the openings of the ureters will be seen from inside around 5 centimeters apart. There is a distance of 5 centimeters between the two ureteric openings inside the urinary bladder. Coming to the blood supply of the ureters, the upper part of the ureter is supplied by the renal artery, middle part by the branches of the aorta, and the pelvic part is supplied by the vesical artery, the middle rectal artery, or the uterine vessels in females. The venous drainage will correspond to the arteries itself, okay, and finally drain to the inferior vena cava. Lymphatic drainage, the upper part by the para-aortic lymph nodes, middle part by the common iliac group of lymph nodes, and the lower part by the internal and external iliac group of lymph nodes. Now supplied by the sympathetic by T10 to L1 segments, parasympathetic by S2, S3, and S4. Okay, this is a case which I was telling. Duplex kidney or duplicated ureter here. You can see. So there is 2 ureters can be seen on the left, on the right side here. This is another picture where the ectopic ureter is being seen. Okay, so meaning from the kidney there are 2 ureters are being formed. Okay, so one is having a normal course, other one is actually moving directly to the bladder. Okay, directly actually near the neck of the bladder. Okay, so it or sometimes it will reach to the urethra also. Okay, sometimes it will reach to the urethra also. That is called as ectopic ureter. It's called it's a condition of the mega ureter. You can see there's a large and tortuous ureter being seen here. Okay, this is a mega ureter. This is an barium X-ray. Okay, barium dye X-ray. So we can see the mega ureter here. Okay, these are the cases where the ureteric stones are seen. Okay. Once again, here you can see stones. Okay, here. Okay. Here also you can see some of the stones. Okay, so that was about the ureters. Thanks a lot for everyone for your patience listening.
Thank you, sir. Sir, a small request to you if
Yeah.
you are comfortable.
Yeah.
Sir, I got two messages to have a explanation regarding the arterial supply and division of arteries inside the kidney. So if you
Okay.
are comfortable,
Yeah, sure.
can you
Yeah.
please?
Yeah, I'll repeat the
Thank you.
same thing. Yeah.
Thank you, sir. Thank you so much.
Is it visible? The slide is visible?
Yes, sir, it is visible.
Okay. Okay. See, the kidneys are actually separated by the renal arteries. The renal arteries are the direct branches of the or the lateral branches of the abdominal aorta. So both the renal arteries, we'll take one renal artery here. Yeah. Okay. This is the left renal artery here. So it will divide into anterior and posterior branches. Okay. So both the anterior and posterior branches will again divide into segmental branches. Segmental branches. Okay. So you can see here, the posterior branch is not seen here actually. So anterior branch only we can see. So anterior branch is dividing into segmental branches. Okay. So these segmental branches will further divide into interlobar arteries. Interlobar arteries. You can see these are the interlobar arteries. This one and this one here. Interlobar arteries. So these interlobar arteries will further continue along the renal columns, along the sides of the renal pyramids, and reach the cortex. Reach the renal cortex. Once they reach the renal cortex, they are named as arcuate arteries. They are named as arcuate arteries because they are arching out here. That's why it's named as arcuate arteries. Okay. So these arcuate arteries again, give out small branches which are known as the cortical radiate artery. They are radiating into the cortex. So they are known as cortical radiate arteries. So these cortical radiate arteries will end in afferent arterioles. They end in afferent arterioles. These afferent arterioles is the one which is finally entering into the glomerulus. Okay, glomerulus of the nephron. Okay, so from after the course in the nephron, they come out as efferent arterioles. They come out as efferent arterioles, and these efferent arterioles will join to form the peritubular capillaries. It is not seen in this picture particularly. Okay, they form the peritubular capillary plexus. So these peritubular capillary plexus will finally form the venules. So these venules will be continue to or emerge out as the cortical radiate vein. Cortical radiating vein. You can see here the blue color lines along the cortical radiating artery. Just on the sides of the cortical radiate artery, they are present here. Okay, they are the cortical radiate vein, and these cortical radiate veins will join to form the arcuate vein. Okay, these are the arcuate vein here arching out. Okay, and these arcuate veins will again join to form the interlobar vein, and these lobar veins will directly form the renal veins. So multiple interlobar veins will join to form the renal vein, and this renal vein will directly drain to the inferior vena cava. I hope this was clear.
Yes, sir. Sir, I'm getting a few more doubts
Okay.
as messages. So, Shall we continue or you need a break, sir?
No problem. Yeah, I'll try to answer. Yeah, if I know the
Yeah.
answer, I will answer. Yeah.
No, no, sir. It is actually like we'll continue only up to one. So I'm
Okay.
getting 2, 3 messages from students.
Okay. Okay.
Okay, so can you kindly give an explanation on the coverings of kidney, the anterior and posterior coverings of kidney, and there is a doubt regarding perinephric fat and the paranephric fat.
Okay. Okay. Fine. Yeah.
Okay.
Okay. So the coverings of the kidney are basically having 4 layers. Okay. Fibrous capsule, which is deep inside or immediately outside the kidney. It is the fibrous capsule or the true capsule. Then we have the perirenal or the perinephric fat, which is the accumulation of the adipose tissue just outside the renal capsule. And these two capsule or these two layers, the fibrous capsule and the perirenal fat, both are actually covered by renal fascia. The renal fascia is nothing but the formation, condensed structure of the extraperitoneal layer or extraperitoneal tissue. Okay, so this is part of the peritoneum, you can say. Okay, then this particular renal fascia is having 2 layers. Okay, the anterior layer is known as the fascia of Toll, and the posterior layer is named as the fascia of Zuckerland. Okay, and outside all these three, outside the renal fascia, we have the pararenal fat or the paranephric fat. Okay, perirenal means immediately outside the kidney. Perirenal. Pararenal means we can say on the sides of the on the kidney, on the outside the kidney. Okay, that is the pararenal fat. So this picture is okay. This picture is more clear. You can see here. This is a transverse section of the left kidney. This is the kidney here. Okay. When you take a transverse section of the kidney, you can see the renal sinus very clearly. This is the renal sinus. Okay. So the first layer outside the kidney is the renal capsule or the true capsule. Okay. Then the yellow color, what you see is the perirenal fat. Perirenal fat, which is immediately outside the particular renal capsule. Okay. The perirenal fat will even cover the renal vessels. Okay. The renal artery as well as veins. Okay. Then outside this particular perirenal fat, we have the renal fascia. Okay, renal fascia, which is actually nothing but the condensed extraperitoneal tissue. Okay, so this particular renal fascia is having 2 layers. One is the anterior layer and the posterior layer. The anterior layer is named as the fascia of Todd. You can see anterior layer is named as the fascia of Todd, and the posterior layer is named as the fascia of Zuckerland. And outside these two, outside these particular renal fascia, we have the paranephric fat, which is more on the posterior side than the anterior side. Okay, paranephric fat, paranephric fat. If this particular paranephric fat is less, okay, then there is a chance of nephroptosis. Okay, then there is a chance of nephroptosis. Yeah, I guess it was clear.
Yes, sir. It is clear, sir. Sir, one more doubt I got is regarding the course of ureter.
Okay. Okay. So ureters begin within the renal sinus. So renal sinus is nothing but the located inside the kidney itself. So they begin as the renal pelvis. Then this renal pelvis will continue downwards and slightly medially on the psoas major, meaning it is coming out of the kidney and moving downwards and slightly medially. Medially means towards the midline here on the psoas major muscle. Then it will enter the pelvis, crossing in front of the common iliac artery. Then reaches the base of the bladder and enters the bladder wall obliquely and opens into lateral angle of the trigone. So you can see here. So here we can see only the part of the renal pelvis, not completely. Then it is moving downwards and medially. Okay. Then it is crossing, it is passing on just in front of the psoas major muscle, and then it is crossing the terminal part of the or termination of the common iliac artery. This is the right common iliac artery, and this is the left common iliac artery. It is terminating here means it is dividing into further, that is the internal iliac and the external iliac artery, and then it is entering into the pelvic cavity. Then it is entering the wall of the bladder obliquely, then opens into the trigone. This was the course of the ureter.
Thank you, sir.
Okay.
Sir, the position of structures inside in the hilum of kidney, sir.
Okay. So anteriorly it is the renal vein, and middle we have the renal artery. Then extreme posteriorly we have the renal pelvis. Okay, there is a VAP. It's a mnemonic what we usually try to remember. Okay. So you can see here. Okay, this is actually the left kidney. You can see renal vein is one which looks in the front. Okay. Then immediately behind the renal vein, we have the renal arteries. Okay. Then extreme posteriorly, we have the renal pelvis. So that is the criteria for determining the side of the kidney from anterior to posterior. First one is the renal vein, second one is the renal artery, and the last one is the renal pelvis.
Thank you, sir. So next question.
Okay.
So you mentioned about accessory renal artery.
Okay.
Can you just give a small explanation regarding?
Okay. Yeah. See, the accessory renal artery is actually nothing but a branch of the renal artery itself. Very rarely, it will branch out from the aorta. Otherwise, it is actually branching out from the renal artery before the renal artery is entering into the hilum. That is what the accessory renal artery is meant to be.
Thank you, sir. Sir, one last question. After that, we'll end up the session.
Okay.
Sir, can you just explain the formation of major calyx from the minor calyx and renal pelvis?
Okay. Okay, you can see here in this picture, these are the triangular renal pyramids. So each renal pyramid will open into a small gap here, that is the minor calyx. So this gap here is the minor calyx. So in this location, we can see 1, 2, 3. 3 minor calyx are present here. Okay. So in this, for this particular renal pyramid, there is 1 calyx here. So similarly here also, here also, here also. So all these locations where the each pyramid is opening, okay, or the collecting tubules are opening here. So that is the minor calyx. These minor calyx will unite to form a large space once again. Okay, they are the major calyx. Okay, so here you can see 1, 2, and 3 major calyces. So these major calyces will again further continue or narrow down as renal pelvis. So minor calyces are the beginning part, and then it ends up in the major calyx, and then major calyx will further further continue as the renal pelvis. Yeah, I hope it is clear.
Yes, sir, it was. Yeah. Thank you, sir. Thank you so much for giving your time today.
Thank you. So, thanks for inviting me. Yeah.
Yeah, tomorrow we'll be continuing the session on the same time, 11:30 to 1 o'clock. So I hope by tomorrow we'll be able to complete the urinary system.
Definitely.
If students are having further doubt, we'll be discussing it tomorrow.
Okay, fine. Yeah.
Be comfortable for you, sir.
Yeah, it will be definitely. Yeah, no issues.
Okay. So I thank you so much, sir, for giving your time on behalf of Department of Anatomy and also Shiva Ayurvedic Medical College. See you tomorrow, sir. See you for the session tomorrow. Thank you, sir. Thank you so much.